Please help me to welcome Alisson Lass, a licensed psychologist at Sanford Health. She joined the team in 2024, earning her PhD in clinical psychology from Mississippi State University and completing a fellowship in clinical health psychology at Mayo Clinic. Lass specializes in the treatment of chronic pain, depression, and other chronic symptoms. Dr. Lass works with patients in the pain clinic and behavioral health. Please welcome Dr. Alisson Lass. Is it Lass? Lass.
Hello, everyone. Thank you for the kind introduction. I'm happy to talk with you all about mental health and chronic conditions. My goals for today are to review the important differences between acute conditions and chronic conditions, to provide an overview of some of the more common mental health challenges associated with living with a chronic condition, and then to introduce some coping skills and lifestyle changes to help manage mental health in the context of chronic conditions. Let's see if I can get on the right slide here. Okay. So, first I want to provide just a brief overview about the differences between acute and chronic conditions. And of course, many people know this, but it's really important to differentiate between the two because healthy coping often looks very different when someone's coping with a chronic condition compared to an acute one. So when I think of an acute condition, a few good examples would be something like the flu or a sprained ankle. Oftentimes, symptoms of an acute illness can present very suddenly. They can feel very miserable, but typically, folks kind of have some hope and knowledge that, after the condition resolves, you get back to life as usual. Some examples of chronic conditions would be something like heart disease, it would be something like diabetes, arthritis. These are conditions for which there isn't necessarily a cure, but these things can be managed, especially to help kind of eliminate some of the negative impacts that they can have over time. Now, the difference is that the onset of the symptoms and the course of symptoms may vary. However, when you're coping with a chronic condition, it's not always as easy or sometimes not even recommended to just get back to life as usual. Oftentimes, you have to kind of make some adjustments or changes. So, thinking about mental health challenges, first of all, many individuals with chronic conditions are very healthy from a mental health perspective. However, when concerns arise, typically we are going to see things like increased stress, symptoms of depression, and anxiety. So when we're thinking about stress, living with a chronic condition often requires change. And change of almost any kind, even positive changes like getting married, they're going to be stressful. And so we kind of have to be prepared for that. There's often a lot of learning involved in managing a chronic condition. You have to learn about your symptoms and what's safe. And this can be overwhelming. It's a lot of information at once. Oftentimes, living with a chronic condition involves adjustments to your routine. Maybe you've been asked to change your eating, so now you have to learn new recipes. You have to create a new grocery list. Maybe you're even asked to eat at different times of the day. Maybe you have to record symptoms and vitals. All of these things require changes, and that can be stressful. And now maybe your favorite food is on a list of foods to avoid or try to eliminate from your diet. Or maybe you're asked to exercise every day and you're not so thrilled about it. So sometimes you also have emotional reactions to some of these changes. And then we have to think about how chronic conditions can impact relationships. So maybe your symptoms were a little bit more difficult to manage for a while and you missed a few days of work. And now everyone at work, every time they talk to you, is saying, "Oh, how are you doing?" And every conversation ends up kind of going back to your health. That can be really stressful, especially when you're just trying to have a good time and people are bringing up things that maybe you just wanted to get a little break from talking about. So all of these things can kind of accumulate over time, and it can be perceived as maybe more stress than what you might like. Next, we have symptoms of depression. So anytime a condition persists despite medical intervention, that condition can start to impact the way you think, how you feel, and your relationships with other people. Sometimes with a chronic condition, it can make it difficult to engage in activities that you've historically enjoyed. Maybe you really like going fishing, and every year you and your buddies make kind of a big deal over the fishing opener, and this year you weren't feeling well, your symptoms were high, and you weren't able to make it, right? That's gonna be not great, right? That's a bummer. Well, if that's the only event that you missed, maybe you bounce back pretty quickly. However, say that it's not the only event that you missed. Maybe you missed fishing opener, and then your family got together, but you weren't feeling well, and you were at home, and you're seeing all of these pictures of everyone getting together, and you're at home, and you aren't feeling well, right? That's hard. And when that happens over time, people can start to struggle with symptoms of depression. So I'm gonna use an analogy here, right? Imagine that you're riding in a car. When you steer the car, you're in charge, and you get to go where you wanna go, right? Well, sometimes when chronic conditions are new, or maybe they've been a little bit more difficult to manage, it can feel like your symptoms or your condition is steering the car, and you're just along for the ride. And when it feels like your condition is steering the car, typically people can start to experience some symptoms of depression, because chronic conditions just kind of have a tendency to steer that car away from the things that you care about. So especially if the chronic condition has been hard to manage, it can be common to feel kind of a sense of helplessness or hopelessness. And over time, this can become kind of a bigger issue, and people might struggle with symptoms of depression. And then we have anxiety. Anxiety can be really tricky, especially in the context of chronic conditions. So something that's tricky is how to manage the physiological sensations that are related to chronic conditions. It's important to realize that our bodies are designed to respond to symptoms as though they're acute. This keeps us safe. So if you notice chest pain, that's often going to be very alarming, right? Because it could be an emergency. It's helpful. It could be an emergency. If we didn't feel anxious, we probably wouldn't seek medical care. We wouldn't do anything about it. That anxiety tells you, stop, you need help, right? Well, the thing that's kind of rotten is that with chronic conditions, you might have physiological symptoms that can be very uncomfortable and alarming, but those symptoms aren't always immediately dangerous or harmful. So for example, say you were diagnosed with AFib, right? And certain activities make you feel like your heart is just pounding and you feel really weak. Now imagine you've had the full workup and your doctor assures you that as long as your resting heart rate falls within this certain range, daily activities are perfectly safe. And you've been assured that things are safe, but when you stand up, your heart feels like it's pounding, right? That feeling has evolved over time to be alarming. And so it makes sense that you might still have anxiety when that feeling comes up, even if you've been told it's safe. So additionally, when you're living with a chronic condition, you might have a lot of concerns about safety. What activities are safe? What activities do I need to be avoiding? People might also worry about long-term outcomes. What does the future hold for me? There might also be fears associated with other people. What are they going to think? How are they going to respond to me as I manage this chronic condition? So for example, maybe you experience shortness of breath when you're doing physical activities, and your friends invite you out to coffee, but they pick this place in the mall, and it's a really long walk from the parking lot, and you know that when you get there, you're going to be out of breath. You might worry, oh, what are my friends going to think when I show up and I'm out of breath? How are they going to respond? What are they going to say, right? Or maybe you get lightheaded when you have to stand for a long period of time and you like to go to church on Sundays, but that communion line just seems endless. You might think, oh my gosh, what if I fall down? What if I have this embarrassing emergency and everyone's looking at me? These things can be really common when you struggle with chronic conditions and chronic symptoms. So again, It's very common to have anxiety related to medical conditions because the physiological symptoms themselves have evolved over time to feel alarming. It can be difficult to figure out how to respond to these symptoms and figure out what's safe. So now that we've talked about some of the things that can kind of come up, we want to think about how do we prevent some of these undesired symptoms or outcomes? And the good news is that there's a lot that you can do. So when we think about stress, first, it's important to manage the expectations that you have for yourself. Learning takes time. New habits take time to develop. This doesn't happen overnight, and you don't want to expect perfection. Right? We know that it's important to follow recommendations, but really no one is perfect. So maybe you're trying really hard to change your diet and you've been doing really well, and then it was your birthday and you went out to dinner and you had a steak, and you know you're not really supposed to eat red meat. Well, what's important here is when people try to achieve perfection and then you don't live up, because no one's perfect and no one does, right? There can be this all or none mentality that can kick in. You might think, oh, okay, I've already failed. This new diet isn't for me. I just can't do it. I'm not doing this anymore, right? Well, if you've done something that you can't change, it can be helpful to learn to say, oh, well, and move on. Try to get back to your goals after, right? If you're too hard on yourself and you expect perfection, you might give up on changes that are actually really important to you. So you want to be kind to yourself as you adjust. And what's important is that you keep trying. Next, we want to understand what stress does to the body. So when you experience stress, there's a very reliable response in the body. You take shorter breaths, your muscles get tense, you have more anxious thoughts, your heart rate increases, your blood vessels constrict, and your body also releases stress hormones like cortisol and adrenaline. If you've ever heard of the fight or flight response, this is it. Well, this can be really helpful to deal with momentary stressors. But if you're dealing with something that makes you chronically stressed, having your body regularly in this activated state can be really exhausting and it can take a toll on your health. So we can actually counteract this response through formal relaxation practice. There's a different response called the relaxation response, or we might refer to this as kind of the rest and digest response. We can actually activate this in the body through deep relaxation. So when I say formal relaxation, I say this because people oftentimes think about activities like watching TV as being relaxing. And that may be true. However, if we want to activate that rest and digest response and get a deep state of relaxation, a more formal practice is often required for that. We need a bigger effort to get our body to relax when you have high levels of stress. So I'm going to provide just a brief overview of 3 relaxation exercises. For the sake of time, we won't necessarily practice them all together, but the very nice thing about technology these days is that all of these things are available on YouTube. Actually, I want to go back. There we go. So I have this up here. Feel free if you want to write it down or take a picture. Deep breathing, progressive muscle relaxation, and guided imagery. We'll briefly review those. You could type those into YouTube, and someone will walk you right through it. It's very nice. So the first example is deep breathing. So I'm going to demonstrate this because it's really foundational to relaxation, and I'll invite you to join in if you'd like. So I'm going to put one hand on my chest and one hand on my stomach. So if I'm sitting or standing up straight and I take a deep breath, what happens is that the hand on my stomach moves, but the hand on my chest stays relatively still. Right? And so if you want to try that, if you're taking a deep breath, the hand on your stomach is going to move a little bit more. It often feels very different than the way that we typically breathe. So I'd invite you to practice that for just a few seconds. Now, if you're not sitting up straight, what happens is you get more movement like this. So that's okay. If you have a hard time with this, it can be helpful to practice it like lying down in your bed. That just is a better position to get a deep breath. But if you do that, you want to just see, can I breathe just a little bit deeper than I was breathing before? Sometimes people get really hung up about trying to breathe slower, and that can be helpful, but if you're breathing deeper, you're probably breathing slower. So you just try and get some deep breaths. So if you're practicing that, take one more breath, and then we'll come back and refocus. But that's deep breathing. You can do it for as little as you like or as long as you like. There's not really a right or wrong way. You just want to take deeper breaths than you're already doing. That can help activate kind of that rest and digest response or that relaxation response and get you a deeper state of relaxation. Now the next is called progressive muscle relaxation. We won't necessarily practice this, but I'll review it. So in this exercise, you can basically go from head to toe, and you start by tensing your muscles and then relaxing them. So for example, if I'm starting, I might raise up my eyebrows really high and then relax them. Then I might force a big smile and then relax. Then I might bring my shoulders up toward my ears and then relax. And so if you're really doing this and trying to relax, you probably go slower than that, right? But by the time that you're done, you've gone through and you've relaxed all the muscles in your body. So that one's personally my favorite one. I recommend it. It can be very helpful for getting that deeper state of relaxation. So lastly, there's guided imagery. This is basically exactly as it sounds. You just imagine yourself in a relaxing place. So if I'm imagining that I'm by the ocean, I'm probably going to close my eyes and imagine the feeling of my toes in the sand and maybe that nice feeling of the sun on my skin, right? You try to imagine it with as much detail. I'll probably see, can I hear the sound of the waves or maybe some birds chirping? Try and smell the air by the ocean, right? You want to immerse yourself in it as much as possible. And the nice thing about this one is it can be anything, right? It could be a place that you've been, a place that is made up that you don't know of. It could be, your grandma's house if you had nice memories there. You just try and imagine yourself in a relaxing place. And you do that with as much detail as you can. So for my patients that struggle with chronic conditions, I typically recommend a daily relaxation practice. So the research suggests that 30 minutes per day would get you the maximum benefit, and that can be split up into different chunks throughout the day, so 5 minutes there, 10 minutes there, whatever. For many people, 30 minutes is kind of a stretch. It can be difficult. I always tell people any amount that you do is better than none at all. So while you might get the maximum benefit at about 30 minutes a day, if you do a couple minutes here or a couple minutes there, you forget and then you do it again later, that's fine. You just do what you can. But any amount is going to be better than none, and it can be really helpful to get that deep state of relaxation to help counteract some of the activation that you get just from the added stress. So let's talk about some ways to manage depression and anxiety. So the first thing that's going to be very important is that you need to know if there are activities that aren't safe for you or things that you need to be doing to ensure that activities are safe. So for instance, if you need to be monitoring your resting heart rate or checking your blood pressure, anything that you need to do, we need to know what that is. So it's important to ask your doctor about this and ask very directly if you have restrictions on your activities, because that's just going to be really important to know. But once you know it's safe, it's really important to try and get back to living your life as much as you can. I hate the word normal because, what's normal? What's normal for one person is different than another. But everyone kind of has a sense for what feels normal to them. And so it's important that you get back to living life as normal for you, as much as possible. So if you enjoy golfing and that's safe for you, you need to get back to golfing as much as possible, right? If you empty the dishwasher in the morning, you need to get back to emptying the dishwasher. These activities bring positive emotions, right? So something like golfing or socializing, that can bring kind of feelings of joy. Things that, maybe are less fun, like chores, they bring a sense of accomplishment, right? These are positive emotions, and without positive emotions, people often start to feel depressed. So it's really important to get those activities back in your life as much as possible. So when managing a chronic condition, we often think about the terms moderation and modification. So to moderate activities, you might want to see how long you can do a certain activity without symptoms getting worse. And then you do it for that long, or maybe just a little bit less. And then you take a break, and then you get back to it. And then you take another break if you need to, and you can do things for shorter periods of time with breaks in it. So for example, if you typically do the dishes in the evening, but standing up to do the dishes kind of makes you dizzy in the long run, but you know that you can stand for 5 minutes without having a lot of symptoms, and I might say, okay, go ahead and do the dishes for 4 or 5 minutes at a time, and then you take a little break. And when I say a break, you don't have to just twiddle your thumbs and wait, because that would be really annoying. You can do something that you like during that time. It's a break, right? So you take your break, and then you might go back to that activity. So you see how long you can tolerate an activity without your symptoms getting worse. And then you do smaller chunks with breaks. That's a way to get back to activities that maybe have caused some discomfort or symptoms in the past if they're safe. You just do smaller chunks with breaks. The important thing is that you don't say, I can't do the dishes anymore, or I can't, go for a walk anymore, if those are things that bring you positive emotions, just because you can't do it all at once. We want to moderate those activities so that you feel like you can do them. We might also modify activities. So if we go back to that example of golfing, say that you like to go golfing every Saturday. You do that with your friends. If you can do that activity safely, go ahead and do it. However, say maybe you have some temporary restrictions, you're not supposed to walk long distances, you maybe go and you ride in the golf cart. Or say that you can't swing, you might go along for the social part of it and keep score or whatever you need to do. We want you doing whatever you can to get back to that activity of golfing, because that's going to help you feel those positive emotions and feel like yourself again. So as we talk about this important feeling of normalcy, sometimes there are people that disrupt that for us. And oftentimes, the nicest, most well-meaning people do this the most. So for example, say that you've been adjusting to a chronic condition, and there have been some ups and downs. And maybe in the past you had a lot of symptoms while you were doing physical activities. But your doctors cleared you to do them, those are safe now, and you're going out to mow the lawn and you tell that to your spouse, and then their eyes get about this big. Oh, honey, you come back in, I will mow the lawn, you should sit down and rest, right? Now this reaction would be totally appropriate and helpful if you're experiencing an acute issue like the flu, or you've been told that it's not safe right now. Then that's great, that's fantastic, good to have the help. If the activity is safe, then this reaction is no longer helpful. This reaction prevents you from getting back to activities that might make you feel more like your usual self. And it can cause anxiety, right? Oh gosh, if they don't think that's safe for me, then maybe it's not. Ultimately, over time, things like this can decrease the confidence that you have in yourself. So in these situations, it can be really helpful to sit down and have a direct conversation to address the issue. So in Minnesota and North Dakota, assertive communication is a rarity. It doesn't happen very often, but it's very important. So I usually recommend saying something like, hey, I've noticed that you are offering to mow the lawn and you're dishing up my meals at dinner, and I'm so appreciative that you want to help. But I've been talking to my doctor and they said it's totally safe for me to do that. I want to start doing these things for myself again, right? That's a very direct way of saying, oh, it's important for me to do it. You don't even have to be that nice about it, but it's important that you say it and that you feel like you can get back to doing those things that make you feel like yourself. So lastly, I want you to notice your thoughts. As humans, we try to go about the day as efficiently as possible. Well, we have thoughts about lots of things. We often don't stop to evaluate those thoughts because that takes time and energy. But as it turns out, sometimes our thoughts aren't completely true. And the reason why this is important is that our thoughts also impact our feelings and behaviors. So if you remember that AFib example from earlier, imagine that when you stand up, it feels like your heart is pounding, right? So if you stand up and you're about to do something and your heart is pounding, that automatic thought might be, oh no, I need to sit down, right? And so if we're thinking about this model here, the thought is, oh no, I need to sit down. And perhaps that feeling is that of anxiety, and the behavior that follows might be continued rest. I'm going to keep sitting. Well, in the case of that example earlier, that person had been told that as long as their heart rate was in a certain range, and it was in that range, that would be safe. So in this case, that first automatic thought of, oh no, I need to sit down, that might not be completely true, but it's leading to anxiety and prolonged rest, right? Maybe that thought is keeping someone from doing things that they really enjoy, or maybe their doctor said that their AFib would be better managed if they get regular exercise, right? So here we have the thought that is preventing that exercise from happening, maybe even making the symptoms worse, and then we're really in a pickle, right? So if we can identify the thought, then we can ask, oh, is this thought completely true? Then we have the opportunity to try and modify that thought. So in this example, the person could notice that thought and tell themselves, okay, well actually, my heart rate is in that healthy window, and my doctor told me that I should probably engage in physical activity. Right, so that, challenging that thought, might help reduce the anxiety. And even if that anxiety is still there, it might reduce it just enough that then that person feels like, oh, you know what, maybe I still can do this activity that I want to do, right? It doesn't mean that the anxiety has to go away, but if it can help you to do that activity that would otherwise be making you feel good or help you improve your symptoms in the long run, that's going to be really helpful. Right, so one more example of this, because it's pretty important. Maybe you were just released from the hospital. Maybe there are some temporary restrictions placed on your activities, and you're out at the lake, and you're sitting outside, and your family's about to jump in the boat to go water skiing, and you love skiing. You might have the thought, oh, this stinks. I'm never going to water ski again, right? You're upset, and maybe you're feeling depressed, and you decide that you're going to go inside and watch TV so that you don't have to watch the rest of your family have a good time, right? Well, if you notice that thought and evaluate it, is it completely true? Well, yeah, it does kind of stink that you can't do it right now, right? I'm not going to sugarcoat that, right? But is there any reason to believe that you'll never be able to do that again? Well, you might say to yourself, okay, well, my doctor said that once I do cardiac rehab, I'll probably be able to get back to this, right? It's hard now, but it won't last forever. It doesn't change the situation, but maybe it helps manage that emotion a little bit better. And maybe you're even able to get in the boat. Maybe you're a spotter, maybe you drive the boat. You engage with that activity differently, but you're also there and you're engaging with your family and you're having a good time. So that's really important. We want to notice our thoughts, and if it's not completely accurate, if it's impacting your emotions, you want to catch it, check it, change it, right? Catch it, check it, change it. And lastly, don't be afraid to ask for help. This is really important. If you're having a hard time adjusting, you're experiencing distress, you feel less satisfied with life, or you aren't super happy with how things are going, reach out for help. It doesn't have to be an emergency for you to ask for help. It's probably better to ask for help before it gets to that point. I always tell people it's good to let your doctor know, right? It could be your primary care provider or whoever you see. They're probably going to want to know if you're having a hard time. So let them know. Sometimes they could start you on a medication if that's an option, or they might say, oh, it would be good for you to maybe work with this person. They will usually be a good source of knowledge for what the next step would be. There are also, community mental health options as well that you can always kind of look up on your own. And of course, in the case of an emergency, there's a suicide and crisis lifeline, that's 988. That's staffed 24 hours a day in English and Spanish. You can always call there. You can always call. And you can always go to your local emergency department at any point if you are concerned for your safety or you just aren't sure what to do. But these are good resources to know of. So never be afraid to ask for help. You don't have to do it on your own. And it's perfectly appropriate, right, that it can be hard for you if you're experiencing it, or even if you are a loved one or you are, a caregiver for someone that's having a chronic condition. That can be hard as well, right? Even if it's not you that's going through that, ask for help if you think you need it. People are usually glad that you asked. So I believe we might have, let's look at the time, maybe a minute for questions if there are any. Does anyone have any questions about this information? Yeah.
Hello? Oh, it works, great.
Yeah.
So you had talked about like the breathing technique for relaxation, and you said that was your favorite technique to use. Can you give like a real life example of a success story with that, how it turned someone's anxiety around or really benefited them?
Yeah, I mean, gosh, it would be hard for me to pick. So I do this regularly with my patients. More typically, I work with folks who have chronic pain. So, almost always at some point, if someone is experiencing pain, getting into a state of deep relaxation, will help to kind of just slightly turn down the volume on that pain signal is kind of what it does. But I know even myself personally, right, because it's important to use all of this stuff, I know probably about 1 or 2 times a year I get a migraine, right, and those are not fun. If I'm getting one, if I do progressive muscle relaxation, usually I can function a little bit. If I don't do that, then I want to just lay in bed the whole night. But if I get into my room, do progressive muscle relaxation, usually by the time that it's done, I can still, have a video call with my friends. I don't have to cancel that. I might have canceled that otherwise. I wouldn't have felt up to doing it. So I know that's, that's my favorite. I do that if I get a headache. But I know certainly all of my patients with chronic pain, I ask them to do that regularly. It provides benefits, in the moment when you use it, but over time, there are kind of longer term benefits because you're managing your stress better. Yeah. Any other questions? I think I may have time for one more if there's one. Okay. Oh, yeah.
I'd like to. I'd like to comment on that last question because I deal a lot with AFib. I got very aggressive heart disease. For a good example, last week I was driving and it just hit me. It just came on really fast. My heart was pounding, and I thought, okay, calm down, because I get a lot of the mini PVCs, and I go into AFib quite a lot lately. And what helps me if I'm at home, well, I did go to the clinic, and I was at 150. So then it's like, okay, you need to go up to the ER. We'll call and let you know we're going up there. Sure enough, like it always happens at home, I get out there, I go back and sink. But if I'm really having a hard time with panic attacks, anxiety, I've done the deep breathing, and that does really help. Or I'll grab a word search or a book or something just to keep my mind off of what I'm experiencing and feeling. So that's just a helpful few little tips that help me.
Yeah, thanks for sharing that. It's always nice to hear from someone, and that's one thing that I like about progressive muscle relaxation is that it does keep your mind occupied a little bit more than if you're just focusing on your breathing. That distraction can be really helpful when you're experiencing symptoms or things that are otherwise distressing. So thanks for sharing that. And thank you all so much for your attention. It's been such a privilege to talk to you all today. Thank you.
Thank you again, Allison. Thank you for being a part of the Rock from the Heart community and for joining us today. Your presence and engagement make a huge difference in raising awareness and building a stronger support network for those affected by aortic and heart valve disease. Thank you so much for attending today.